for logging in. My name's Drew Wolf, and I have the privilege of serving as the Business Partnership Director here at the Minnesota Hospital Association. And I also oversee our Endorsed Business Partner Program, which at a super duper high level is we go out and listen to our hospitals and hear what are those pain points that our hospitals are suffering through, and can we find good partners to help them with some of those pain points. And revenue is a very tough one to solve, but we've got a revenue generating partner here today, and we're excited to announce that they have been working with us in conjunction and have created the MHA Connectivity Consortium. And they're going to talk a little bit about how there's funding available for IT and those types of activities that you may not be aware of or perhaps are not maximizing all the way. So excited to hear from the group at hand. Before we get started, just a couple housekeeping notes. Today's webinar is being recorded, so everybody who registers, so if you have to drop off early or you're in the entire attendance, doesn't matter. You'll get an email from me later today that has the slide deck, and it will also have a link to today's recording, so you're welcome to rewatch those key points that you may have missed or forward to anybody else at your organization. And then after that, you're welcome to follow up with the team here at the MHA Connectivity Consortium if that's something that's of interest to you. We love questions, so please use the chat function or the Q&A function. I'll interject those as the presentation is going along, so please feel free to use that. And without further ado, I will turn it over to the team at the MHA Connectivity Consortium, Aaron, Tracy, and Randy, to walk us through today's program. Guys, it's all yours.
Thanks, Drew. We couldn't be happier to be with you today. I'm here from Evergreen, Colorado, where I saw the first snowflakes of the year this morning. So probably some folks in Minnesota have seen some already, but we can tell that fall is here and winter's not far around the corner. So wanted to start off by saying that we're really happy to be a new business partner of the Hospital Association. We've got a lot of experience in other states with similar arrangements in helping increase funding for the hospitals. And we're going to go into a little bit of those methods today and how that works. And hopefully there'll be some people that might be motivated to increase their funding. And we'll get into that. And I also wanted to mention before we really get started, if some of you are looking at this and saying, oh, USAC funding, we're already doing that. This presentation is for you. So please stay on, have some interest. You may hear some things you haven't heard before. It's one of the reasons that we were hired to come into Minnesota and help look at what the hospitals they are doing. So anyway, just wanted to point that out. This is there will be stuff in this presentation for everybody. And I wanted to start with a level set because I'm not sure that everybody is starting from the same place knowledge-wise. So we just want to do that real quick. This is the Healthcare Connect Fund, and it's under the FCC's Universal Services Program. And all of your organizations contribute. If you look at your telecom bills, there will be a tax section there that will be called the Universal Services Fund, and you'll see it. And you personally also contribute to this fund on your cell phone bills. You'll see it in the same tax section. And so that's where the money comes from. And it goes up to the FCC, and it goes back out to schools, libraries, and healthcare providers. And what we do is help the healthcare providers get their share of it. Currently, there's about $4 billion for schools and libraries, while only $700 million for healthcare providers, and hopefully we'll see some reform for that in the years to come. And what it does is it subsidizes broadband connectivity, the infrastructure to run it, and the maintenance and management costs that are associated with that. It provides a 65% subsidy on those services. And like to distinguish that between a grant. This is a subsidy, and if the way the subsidies work, if you are an eligible entity, and we'll go through that in a second, and you apply for eligible items, and you do it on time with the proper applications, then you get the money. There's no write-up for meritorious project, and there's no follow-up paperwork that goes on with grants. This is a subsidy. It's a 65% subsidy. And there are some advantages to being in a consortium. And so if you're out there filing individually today, taking advantage of your rural location, there's some advantages to the consortiums, and we'll go into that. This is the folks on the healthcare side that are eligible to participate. Have to be not-for-profit, and all not-for-profit hospitals in Minnesota will be eligible to participate in this consortium. Rural health clinics, you won't see urban health clinics, but rural health clinics are eligible. Community health centers, mental health providers, public health departments, teaching institutions that teach healthcare, or a consortium of the above. And then we have the non-rural HCPs, the larger rural or urban hospitals can participate if they belong to a consortium that's going to stay more than 51% rural, which we will make sure that the Minnesota one does. There are some eligibility caps for the largest hospitals that are non-rural, but we can help those hospitals work through that. All right, something we hear a lot, questions we hear a lot of, and so we're going to address this pretty quickly. And the questions are around the new administration, federal funding, DOGE, what's up with these funds, and how does that all fit in? And so there's really been a couple of developments around that in the last couple of years. And one is a Supreme Court case was brought against the Universal Services Fund, and because a lower court had ruled the whole program unconstitutional. And the issues were, you see that fee that's on the bottom of your cell phone bill. Is it a tax? Is it a fee? And does USAC have the ability, as a person that's been handed authority by the FCC, do they have authority over taxes because they're not a elected entity? And so those were the challenges against the program. The Supreme Court looked at it and overruled the Fifth Circuit Court of Appeals and ruled that the program is legal and constitutional. So that was a major development that just happened earlier this year. Secondly, there's been a new head of the FCC that's been brought in by the new administration. And so we look to see if he has anything on record and what his views of the programs are, and finds out that the new head, Brendan Carr, is actually an advocate of the Universal Services Program, believes that it solves some really good provides some really good benefits for the right folks out there, and is an advocate for not only keeping the program, but believes that there has been some underfunding of it in some ways, that there's some high-tech companies that are benefiting from it but not contributing. And so he's an advocate for reform for that one thing, as well as there's a potential for overbuilding and people using the funds for, let's say, like a large urban hospital is going to, build fiber where there might be, 5 or 6 providers that already have fiber built in, and it might not be the best use of funds, especially when there's rural locations that could use fiber, so those are the kind of things that they are advocating reforming. But they did acknowledge that this program was put in place by a congressional act, and it would take a congressional action to make those kind of reforms. So I don't think that anybody would argue that there's certain reforms that are needed. It's a 15-year-old program or so, and some of the technologies have evolved over time, and so we think reform would probably be good. Excuse me. So I just wanted to address those things about the program. All in all, from a bottom line perspective, we believe that we're onward and upward with these programs at this point. All right, so this is where I alluded to earlier that this there will be some things for some existing participants in the program. So the things that are going to be eligible in the program are wide area network related, the circuits that go along with that, the infrastructure, the management and operations of that infrastructure and circuitry. So if you can think of a data circuit anywhere from DSL all the way up from a 10 gig wave circuit, and everything in between, that's going to be eligible in the program. And many of you folks that are participating in the program are taking advantage of it. And that's why I've got these boxes colored red. ISDN PRIs still eligible. If some of you are still running those, that's the only phone service that's eligible in the Healthcare Connect Fund. Routers and switches, excuse me. And these are the routers and switches that run these circuits. So while switches are eligible, not all switches in your hospitals are going to be eligible. Firewalls, firewall services. If you can think of a flavor of firewall, it's probably eligible. And then along with this equipment, maintenance, licenses, warranties, all that goes along with it. It's all eligible. We have network management, maintenance, and operation services. So think of third-party IT support. If you have companies that are in your hospitals managing these infrastructures, that is going to be an eligible service for subsidy. Fiber, all phases of fiber projects eligible. And if you have an offsite data center that's could be in an urban location, it could be anywhere, but it could be at another hospital even. But if you are paying for circuitry at another site, then that site also is eligible. Now, the reason I have these two colored red is because we analyze a lot of folks, and we analyzed a lot of you folks in Minnesota already about your participation in the program. It's a federal program, and the data is available to anybody that wants to go look at it. And so what we do is we tied our database to it, and we via API, and we can do custom looks at the data and reports. And what we've seen, and one of the reasons we were hired in Minnesota, is there's a preponderance of folks using the program, applying for their circuits, but leaving out all of the other eligibility categories. And what that amounts to is just money being left on the table for not applying. And we realize that edge switches and routers and firewalls are not purchased every year. But if we look at your filings over the last 5 years, we would certainly see these kinds of purchases being made by your hospitals. And by not applying for it, you saw the subsidies that you're looking at. It's just leaving money on the table. And to be fair, this might be the first time that many of you are hearing about these services or products are eligible. We see that a ton in other states that we work in. People were just never made aware. They're using consultants. They've been using consultants for years, usually the same one. And they just have either they haven't been told about the other products, or the consultants only contract to do the circuits. In either case, there's money being left on the table, and that's what we're here to help with identifying where the funding gaps might be and helping you fill those gaps. There are some other advantages to being in a consortium. Wait, I'm going to go back one because I failed to mention the two green boxes. So the green boxes here represent eligibility categories that are only eligible if you're participating in a consortium. So if you're filing individually, your consultant might even say, you're not eligible for these. And they would be true. But if you joined the consortium, the Minnesota Connectivity Consortium, you would be eligible to make applications in these eligibility categories. And so that's, we alluded to, there's some advantages to being a consortium early on. That's a big one, is you have extra eligibility categories to participate in. The additional advantages are higher project caps. So filing individually, you're capped at $50,000 on a capital project. Yet in a consortium, the formula changes to $50,000 times the number of folks in the consortium. I'm happy to say that we have our first hospital that has joined the consortium. They have 8 sites. So right off the bat, we now have a project cap of $400,000 for a capital project. That's gonna do a ton for a lot of hospitals having that extra money. Now, so I know some smaller hospitals will never have a $400,000 project, and their firewalls cost $20,000, and so that's not a big deal to them. But there will be plenty of opportunities when we start this consortium up, that hospitals will have projects that will get up into the multiple 6 figures. The other part is advanced audit support. There is a high likelihood that at some point in your USAC life, you're going to be audited. And do you want to run that audit, or would you like your consortium to run that for you? This is what we do as part of our services to the Hospital Association. And I can say that having participated in audits in other states, they're not for the faint of heart. There are, by participating in the program, you have signed up to do document retention and other things that will be brought out and in an audit. So it pays to be part of a consortium in the event when that audit is going to happen. We mentioned consortium only eligibility. Also mentioned advocacy. We belong to the Schools, Libraries, and Broadband Coalition. This group is a association of interested parties in the Universal Services Funds, and so we keep our thumb on the pulse of the activities around the funds. And year to year, there's issues with one thing or another, and we help work through those at the national level, at the program level with USAC and the FCC. And so that's also something that you're getting from your consortium. Education and continuity, we think, is a big one. And you may think, what's this about? But if you've ever experienced turnover in your IT group, and we see that there is some that goes on out there, that you lose your education and continuity of participation in this program. And so for many hospitals now, we are the source of education continuity. One of our processes is we go through every year an annual checkup, which includes education. It's a big part of it, because if your team is not educated on eligibility and they keep educated on eligibility, then they're not thinking about it, and they're going to say, oh, well, we lost a router and we're going to just replace it, versus thinking about the possibility of getting it funded. So education's a big one, and it's part and parcel to getting you maximum funding year in and year out. Now, this is also for folks that are already participating in the program. You may be thinking, well, this sounds pretty good. I might be some extra funding, but I've got this existing contract in place with my consultant for another 2 years. That's no big deal, because the program is really flexible. It's never an all or nothing situation. You can keep your existing agreements in place, stay filing for the things that you've historically filed for with those folks, and use the consortium for the extra funding and things that you've been missing. And even if you have your own consortium, and maybe your consultant has set you up with a consortium, it's fine to belong to multiple consortiums at the same time and file under multiple consortiums. So it's really flexible, and it makes it easy for us to come in and help you maximize those dollars, no matter how you're currently set up. And like I put at the bottom, no matter how, you still should be capturing the subsidy. So we can help you look at your existing arrangements and tell how we can make that work. All right, so I mentioned the database that we have, and so we have the ability to go in and look at these funds on an individual hospital level, but we also can then aggregate these. And so we took a look at some of the Minnesota hospitals, actually most of them, and their participation in the program. And we also know that there's a large GPO in Minnesota called Captis that we're also involved with. And there's some hospitals in Minnesota that are part of Captis that we left out of this just because the potential for them to join this consortium, it won't be as great. So this data is an aggregated look at 207 locations. This would include hospitals and clinics and their rural clinics for the most part, and their participation in the program over the last 10 years. And you can see they've been averaging probably close to $500,000 a year in funding, $500,000. And one of the things that we look at then is, if you remember back to all those eligibility categories that we talked about and said that people are participating mostly in those red boxes, that's illustrated by these the blue segments in these graphs. Equipment is obviously the amber section. The fact that management services and network management showed up in our graph meant that they are there, but they're so negligible that they're hard to see. So you can see in the last 5 years or so, 6 years, there's been about $200,000 in equipment that's been funded by 200 some hospitals in the state. And so we would look at that and say there's tons of opportunity for hospitals to increase their funding in some of those other eligibility categories. And I'm going to show you next what we did in Nebraska, one state over, when we came into a similar situation to where the hospitals were participating. We came in 2021, and they were, steadily participating, getting their circuits. There was just a little bit of equipment here, management services but staying steady right there, 300, 400,000 a year in funding. We started in 21, starting to get equipment and network management, network management again. And, equipment's a little bit interesting because equipment is, you don't purchase equipment every year. So there's a few things that have to come together. And when you're brand new into the program, as sure as I sit here today, or I should say, as sure as Purdue will win the Big Ten in basketball this year, that you're going to say, oh, we just bought firewalls last year. We just bought switches 2 years ago. So it takes a bit to get equipment iterating in the program. And so you can see once you start to put in network management and equipment into the program, what it does for your overall funding. And these hospitals, that were participating in the program before 2021, and the same hospitals now participating after 2021 are getting 4 or 5 times the amount of funding. And when you start adding those additional eligibility categories, that's where that funding increases. And you can see it graphically here is what we've done in Nebraska. And I can't wait for 4 years from now to show you the same results that we're going to have here in Minnesota. All right, so I'm going to turn this next over to Tracy Hines, who's in charge of our customer success and our onboarding. And she will go through the schedule that we have coming, because this is an annual program and their deadlines. And so we're going to go through what that looks like for this year. Tracy?
Thanks, Randy. Thanks. That's a good overview. Yes, my experience is more in the operations and keeping all the project on track. So this is an annual program. It's July 1 to June 30th every year. And in the fall is when we really get started outreach to all of the members, onboard new members, and go through the process. So the first thing that we would do is look at your services you have currently, and we kind of end up being one of your partners where we're going to work with you and see what you need. As far as if you needed upgraded circuits or you needed firewalls, network management. So we would understand what your network looks like today and what you'd like it to look like in July of 2026. So first thing we have to do is we have to follow the federal guidelines, of course. So anything that receives federal dollars has to go through a fair and open bidding period, which is a 28-day posting of the general services of what you want and any wish list that you'd like to have. We have to put it out there for opportunity for any vendor to see and have the opportunity to do a bid for. On that 29th day, as soon as that closes, we review any outcome. So if we had received a bid or if we had not, we follow back up with you and say, okay, the bidding period has passed. What would you like us to file for? What do we want to get funded? So we'll kind of dive a little bit deeper and get invoices, contracts, and work with you. And if it's equipment, a quote would work. Just a quote from a vendor would work in order to submit that for funding. But we work closely with you during that period. And from about January to March, we are busy doing all of the filing. So in the fall, we're doing our posting. End of the year, we're doing our review because the RFPs have all closed. And then we start doing the paperwork with USAC. The hard deadline is April 1st to have all of our funding requests submitted. And July 1st would be the start of the fund year. So between April and July, there's a lot of waiting. Sometimes we'll get information requests from USAC asking for clarity around our funding application. But this year we had our first funding commitment start to roll out the first week of July, which was the earliest ever, which was exciting. And then on July 1, if you had wanted to purchase equipment in that fund year, you're okay to do it. So that is kind of the fund year in a nutshell. The funding commitment comes in, and then we start dispersing the funds throughout the fund year. And the next slide that we've got, we usually use, it looks busy, but what it shows is that we are doing the application months in advance of when you're going to need your equipment or new services. So right now we're in October, believe it or not, of 2025, and we are working towards services beginning July 1 of 2026 through June of 2027. And the biggest thing I like about this slide is it just shows how far in advance we're working. And so it shows how far in advance we should be planning. So if you have a project plan on, kind of in the forward thinking of your network refresh 2 years from now, we actually should be talking about it now, because we want to make sure it gets in the correct application so you can purchase it in the correct fund year. And we do get a lot of questions from members saying, well, my budget timeline doesn't match with USAC's timeline. I can't participate in any of these more difficult applications. But you can. There's ways to work around it. We partner with you, talk about options, If you, speaking of equipment, if you are in the break and fix mode now, meaning that, you know, the firewall breaks and then you go buy one tomorrow and you get it on the shelf and you install it the next day, that's a challenge to get funded. So you can do the option of a leased firewall for a certain amount of time, and then we can get it funded as a monthly recurring charge in the next fund year. So there's some nuances to the program that we really specialize in, and we would work with you to find out what you need when you need it, and then we would back it up to when we would need to apply for it. So that's where this timeline comes in, and it needs to be updated because right now we're planning on July of 27. You know, we're starting to think ahead. So definitely work with us on your projects.
And Tracy didn't say it, but I will. There's no time like the now to start. If you're interested, we don't want to have you wait 90 days and potentially miss it at the end. So if you have some interest, we'll get your paperwork in now and we'll get started. So speaking of that, it is a government program, and so there is paperwork involved. There's a new member packet that we have ready and available. One hospital in Minnesota has already filled it out, so it's not too overly taxing. And they had 8 locations. So and then once we get the documents, we'll call to schedule an onboarding. And what we do with our onboarding is we'll make sure we validate contacts at the hospital that we should be working with, your eligible sites, your eligible services, any projects coming up this year or a couple of years down the road, what that looks like. And based on these projects, identify if there's any vendor prep that needs to take place. Interesting thing about this is this looks very similar to our annual process as well. So Tracy alluded to that. We call it our annual checkup. And this is where we do the education and again, validate all these things for the next few years. And then we'll go through this together and we'll both agree to a finite set of applications for 2026 and we'll get them in by the deadline. I'm going to skip this one. Drew wanted me to keep this to 30 minutes. I see we're 3 minutes over. He doesn't realize I only get warmed up at 30 minutes. So the main thing we want to make sure is plan ahead for infrastructure. If you haven't been submitted your infrastructure for subsidy before, plan ahead is important. We do have a fee for submitting these applications. It's a contingency fee. And so unless you get funding and use the funding, there won't be any fees. But if you do get funding and use the funding, we're going to invoice you for 25% of the funds that you get. And what that nets out to is about a 49% reduction in spend. Once you take into consideration the subsidy and our fee, again, that goes down to about a 49% reduction. We do share revenue back with the hospital association for all the good things that they do around the state. And so that is, and I will also point out that we do know that there are other providers that do this cheaper. Those are what we typically see. They are also the ones that are guiding you into circuits only. And if we've done the math, when you start adding your infrastructure in, the few points that you're saving, you'll end up with more money in your pockets by gaining those extra eligibility categories. All right, so just have a quick, if anyone wants to screenshot the contacts, this is Drew, responsible for the program at the Hospital Association. This is the Connectivity Consortium admin group, and Tracy and Aaron also on the call, and myself. There might be other folks that you work with within the company over time, but we're happy to, anyone on the call here is happy to help answer any questions that you have. So with that, I will open it up to any questions that you guys might have out there and see if we can get through this quickly.
Yeah, and Tracy and I have been answering a couple just behind the scenes that were individual one-off questions, but if anybody has anything for the larger group, feel free to use the Q&A button or the chat button. We can get to it either way. But really appreciate you, Randy and Tracy and Aaron, for sharing your expertise here. I said before we open it up to the public, I'm very excited about this program and what it can do. And I think that my favorite slide in the whole deck is the Nebraska slide when you show the trends of what's happened there. And we think for sure that there's that level of opportunity, if not more, in Minnesota. So really appreciated walking through some of those materials.
And on that line of thought, if any individual hospital out there would like to set up a 30-minute session where we go through your participation and see about if we think there's any funding gaps or if there's opportunity, we're happy to sit down and have those. I think that it's informative to go through, and if you're doing well, we'll tell you that. We're not going to try to hard sell you. If you're doing well, we'll give you the stamp of approval, and you march forward and brag to your buddies. You're getting more USAC dollars than them, but there's a ton of opportunity in Minnesota. We'd love to have those discussions. And also point out, we'll be at all the or a lot of the meetings down there, so we'll be part of the community. And we've already we spent time at the annual meeting just last month. Had fun time golfing and going out on the boat cruise and a little bit of business as well. So
always important to keep that mix in there.
Yeah.
Just maybe one question, Randy, if you can touch on, you had a slide earlier on, it had the kind of the green and the red outlines. When you've worked with hospitals and other state hospital associations, what is the number one category that you're finding that is being missed from those hospitals that are tapping into USAC funding, but maybe aren't maximizing USAC funding? Is there a specific item or category that is more missed than another?
Infrastructure. I would say infrastructure. In a close second is network management and operations.
Sure.
That those are the 90. I would say I don't want to say 90. I'll say 80%. The other ones are additional locations that people don't realize are eligible, like offsite data centers, or a mental health facility that's in an urban location. Just things that people miss when they're setting up. And so, but infrastructure, I'd say, would be number one. Routers, sure. Switches, firewalls.
Terrific.
And again, and all the maintenance and warranties that go along with it, which can add up to the cost of the equipment. And I'll also point out, when you purchase your equipment in the program and get it subsidized with the maintenance and warranty, you can do future iterations of maintenance and warranty without repurchasing the equipment, and it's all subsidized. So it's important to kind of get into that rotation in the program.
Terrific. Good insights. Well, I'm not seeing any other questions come in, so I think we can wrap it up here for today. As I mentioned at the onset of the call, there will be a copy of this slide deck and a copy of or a link to the recording of today's webinar coming to all registrants' inbox here by the end of day today, so you can go back and revisit any pieces of information that you may have missed or need to revisit. Elsewhere, contact information is here on this last slide for the team here at the Minnesota Hospital Association's Connectivity Consortium. And I'm also happy to answer any questions as well. And we really hope that you take advantage of this opportunity because there's dollars out there, and we want to make sure hospitals and health systems are maximizing their access to those dollars. So with that, I will say adieu. Thanks, Randy, Tracy, and Aaron again for your insights, and appreciate everybody logging in today.
Thank you.
Thanks, everybody.